One of the most common things that we see with knee pain is that degeneration and arthritis and that bone on bone. When your meniscus degenerates and wears and tears over time, maybe you actually have tears or had previously torn a meniscus or had surgery, or even if you didn't have surgery to repair the meniscus, one of the most common issues is that your knee is degenerating and wearing and tearing, and it's becoming more and more bone on bone. So as your meniscus, and that's that cushioning right in between here, in between the two joints, once that wears away, there's no more cushion in between the two joints. So that's why most people's knees hurt or bother them, or they get achy and stiff. If you have pain going up and down stairs, or kind of squatting down and coming back up, or getting up from sitting, that is the root cause of the issue. And the problem that most people experience is that the cortisone and the creams and the ointments and arthritis, all that stuff does is just mask the symptoms, and it doesn't ever do anything to fix the root cause of the problem. And so if you're looking at a knee replacement, if you've been told you need to have a knee replacement, if you've been told eventually you'll need to have a knee replacement, and your current orthopedic or sports medicine doctor just wants to wait until it gets bad, or wait as long as you possibly can, as they often will tell you, if you don't want to just wait and sit around and wait for bad things to happen, I personally think that's terrible advice. We should actually do something about it. There are therapies that can help to repair the root cause of the problem. Things like plasma injections, which is derived from your own blood. It's your own plasma. So it's as natural as it gets. There's no drugs, there's nothing artificial or synthetic, and it works very well. If you're more advanced arthritis, stage 3, stage 4, in terms of arthritis and degeneration in the meniscus and the knee, then we can use something like stem cells to regenerate, to rebuild the damaged cartilage and repair the damaged meniscus, to reverse the whole bone-on-bone thing. And it works very well. We've been doing it in our office for several years. We've had a lot of good success with it. There are a lot of different protocols and kind of customizations that we have to do. So short answer on insurance that everybody always has is there's not a lot of insurance coverage. You may have some coverage, you may not. What we have to do first is evaluate your knee, take a look at your current x-rays, your current MRIs, if you've already had some. If you don't have MRIs and we need them, we'll send you for an MRI. But we have to figure out what the root cause is first. We have to physically evaluate and see your knee and see how you move, how you bend, how you walk, because that tells us a lot of information. From there, we will figure out what the game plan is. Is it plasma? Is it the gel? Is it stem cells? There are a lot of different routes that people can take. There's not a one-size-fits-all blanket like everybody gets cortisone. That's what a lot of orthopedics do, and I think that's dumb. And so we have to customize things a little bit better. That's what we're going to be doing for you. So when you come in for your first visit, exam, consultation, x-rays, imaging review if you've already had a lot of images and MRIs, and then from there we'll figure out what the game plan is. That first visit, if you're watching this video, you probably already know, it's only $67. If you fill out the paperwork and prepay for your appointment, it's only $47. We just want to take price and insurance out of the way, out of the question, so it's not even an issue for at least you to get checked out and evaluated. We have to find out what's going on first. Instead of kind of basing your decisions on what you're going to be doing or what you're able to do on insurance, why don't we just figure out what the actual problem is first and then what your options are? That way we can best help and guide you in whatever direction we feel is most appropriate for you and what's really going to help you the most get back to doing what you love to do. That's what this is all about. It's not about treating pain. It's about helping you get back to living your life, playing pickleball, tennis, golf, being able to function and walking up and down stairs, whatever it is that you want and need to do. That's our goal here. I'm Dr. McNabb. I hope that we are able to help you and see you very soon.